Hello, my name is Amber Carnofel, and I will be talking about sound, music, and health. First, I will start by explaining what sound is. From a physics standpoint, sound is the vibration of air molecules. These vibrations cause what we know as sound waves. Sound waves move through the ear canal to the eardrum, causing the eardrum to vibrate. The eardrum is connected to three tiny bones, which vibrate along with the eardrum. The cochlea is a fluid-filled structure in the ear. As the three tiny bones vibrate, the fluid in the cochlea vibrates. This triggers receptors to send signals to the brain to interpret the sounds. There is not just one particular region of your brain that is active while you are listening to music. This image demonstrates how complex listening to music actually is. Not only does your brain have to interpret the actual sounds, like the rhythm, the pitch, and the melody, but it also controls the emotional experiences, the memories, the physical reactions you have to music, like dancing and tapping your foot, and even the expectations of the music, like what you anticipate to happen next in the song. A different area of the brain does each of these things, and sometimes multiple areas are involved. What exactly is music then? Well, music is an abstract experience determined by each individual's own perceptions. For example, one individual may consider classical music written by Beethoven to be real music, while another individual may consider Beyoncé's music to be real music. Each person's reaction to music is distinct, and none of them are wrong. But to give music a more tangible definition, I will quote authors Daniel Schneck and Dorita Berger and say that music is an interpretation of combined sound events organized by human beings to reflect and distinguish internal and external experiences, sensations, and emotions. The physiological effects of music may not be conscious effects, but music causes changes in biochemical reactions in the body, as well as blood flow, breathing rate, hormonal expression, and body temperature. This is why you feel so relaxed when you are listening to soothing music. In a research study studying the effect of music therapy in cardiac rehab, they found significant differences before and after the music therapy in both stress levels and anxiety of the patients. They also found significant differences between the treatment and control groups in their systolic blood pressure and the quality of life. And the quality of life includes like their general health and then their ability to function socially. In another research study studying the effects of music therapy in palliative care, they found that the music therapy significantly improved anxiety again, as well as body movement, facial expression, the patient's moods, the amount of pain they experienced, their shortness of breath, and their verbalization. I use this picture as a background to signify the calming and tranquil effect music can have on an individual. Music in a clinical setting. Music therapy is a planned, goal-directed process to promote wellness, manage stress, improve communication, promote physical rehab, teach social skills, and alleviate pain. Rhythmic auditory stimulation, interactive instrument playing, songwriting, dancing, and imagery are all examples of activities involved in music therapy. According to a research article about music therapy and speech therapy, music promotes increased breath and muscle control, develops receptive and expressive language skills, improves articulation skills, and helps teach social communication. Music therapy has also been used in clinical settings to help children cope with cancer, help decrease anxiety and pain in burn patients, and relieve suffering for individuals in palliative care. These are just a few examples of the uses of music in a clinical setting that I have found. This is a video that I found where music isn't necessarily used in a clinical sense, but music does help an individual heal and help him get through a difficult time.
My name is Michael Johnson, and I'm the next American Idol. I've loved to sing ever since I came out of my mom. My mom would be at church, and she said that the music would start and her stomach would start moving while I was inside. So I've loved music all my life. I recently got my tonsils removed, and the doctor that did my tonsils hit some nerves and left me talking with a speech impediment. When they were taking out my tonsils, it's normally supposed to be like a 45-minute procedure, and they told me that it took about an hour and a half to actually pull out my tonsils because they were so big. So that was where hitting the nerves came into play. It's one in a 100,000 happened to. I go to a speech therapist and it's been helping. If I got a golden ticket, it would bring a smile to my face and it would just prove to me that despite the obstacles, I can still do anything.
I've actually had nerve damage myself, and I thought it was never going to go away. It was in my arm. And I'm just wondering, did they give you hope about it going away?
They said once it healed that this was pretty much what I was stuck with. I do go see a speech therapist, so it's been helping.
So can you sing? Should you be here singing now?
I feel like that I can be an inspiration for somebody else. There are people that have been inspirations for me, so why give up?
Exactly. What are you going to sing tonight?
I'm gonna sing Chicken Fried by the Zac Brown Band.
Hey, hello, we know that song.
Let's hear it.
All right.
Well, I was raised up beneath the shade of a Georgia pine, and that's home, you know. Sweet tea, pecan pie, and homemade wine, where the peaches grow. In my house, it ain't much to talk about, but it's filled with love and grown in southern ground.
Yeah.
And a little bit of chicken fried, a cold beer on a Friday night, a pair of jeans that fit just right, and the radio up. I like to see the sun rise, see the love in my woman's eyes, feel the touch of a precious child, and know a mother's love.
Yeah.
Using music in everyday life. Music is great for relaxing, and it can also help you to focus or realign yourself. When listening to music that soothes you, or listening to music that you enjoy in general, you can feel as though you are becoming one with the music. Have you ever had that feeling where it seems as though music has taken over your body and you are just completely submerged in it? I'll ask you later on to think back to an experience like this and really think about what kinds of effects that experience had on your body. When we listen to music, we connect different meanings and different memories with different songs and different types of genre of music. And if you refer back to the brain slide that I had previously in the presentation, you'll notice again that different parts of your brain are activated when listening to music, and that listening to music gets your whole brain involved and kind of gets your whole self involved. And like Micah Johnson, the clip that I showed, music can really help pull us through a difficult time. Like if you were listening to songs by Frank Sinatra because it reminds you of your grandfather, or you happen to hear the sounds of a trickling brook while listening to maybe a YouTube video that has the trickling brook sound, with maybe some soft music in the background, and that happened to remind you of a camping trip that you took that was really awesome. Those are images that we can use in different types of meditation, and we can use in the imagery with like the heart math, and that's what will bring your heart rate down and help you to relax and kind of calm you and make you more tranquil. And that is also, like, if you were in a lot of pain, what could take your mind off the pain and help you just altogether be in a better mindset. Listening to nature sounds or nature sounds coupled with music can be relaxing due to their repetitive rhythmic tempo. Nature sounds that are lean in bass frequency are the best to listen to. And those kinds of nature sounds include ocean waves, trickling brooks, or breezes. Nature sounds also can bring back memories of past joyful experiences, and these sounds can bring images of different environments that we enjoy, kind of tying in some imagery. This is a link to a YouTube video that I recommend listening to. Even if this kind of music isn't really your thing, it may open the door to finding other types of music that you find relaxing. And here are some questions to kind of think about. Do you think incorporating more music therapy into hospitals and doctor offices would be beneficial? Are there any downfalls in doing so? What types of music evoke the greatest response, like emotional response, meditative response, or physical response, from you? How would you apply this to your everyday life? And then what I referred to earlier, can you think back to a time when you were completely submerged in a piece of music? What kinds of emotions and physical feelings did you have during that time? And thank you for listening.